Hi everyone, I am Dr. Apurva Gupta, consultant gynecologist practicing in South Delhi, primarily based at my clinic called the Gynaecologist Women's Clinic in east of Kailash. Today we'll be talking about uterine polyps. Okay, so what are uterine polyps? Uterine polyps are small growths, small overgrowths which occur inside the uterus. They primarily occur because of overgrowth of the internal lining of the uterus, which we call as the endometrium. So normally these small little polyps are normally small, first of all, and sometimes they are found single, sometimes they are found in groups, right? Most of the times these polyps are benign, that means they are not cancerous. It's quite rare to find a small polyp which is cancerous. Now, these polyps can either be inside the uterine cavity or they can be placed at the mouth of the uterus, which we call as the cervix. Okay, so obviously if it's at the cervix, we call it a cervical polyp, and if it's inside the uterus, we call it a uterine or an endometrial polyp technically. So most of the times the polyps are small. Sometimes the endometrial polyp may be long and large, and from the endometrium it may extend out to the cervix and hang. Now, what are the most common symptoms of polyps in your uterus? The most common symptom is an intermenstrual, premenstrual or postmenstrual spotting or bleeding. So you get your menses, and in between your menses, anytime you start to bleed, you start to spot. You may have bleeding after sexual intercourse. Sometimes they may present as infertility because they may be present at strategically crucial points and patient is unable to conceive. And sometimes the polyps may be symptomless, right? So there are no symptoms and they may be coincidental findings. As far as the treatment of polyps is concerned, we normally like to remove the polyp, obviously. If it's at the cervix and it's external, then sometimes it may be removed as an OPD procedure. And if it's inside the endometrium, then we like to remove the polyp hysteroscopically. So we will undergo a hysteroscopic polypectomy, in which we put in a thin camera inside the uterus. We visualize where the polyp is, and with the help of a cautery, we cut the polyp from its base. It's very important to remove the polyp right from its base of attachment to the uterine lining, because this is what primarily would prevent recurrence of polyps. So they are very easily treatable. The prognosis of treatment is very, very good. And once the polyp is treated, you are nearly symptom-free of whatever symptom the polyp was causing. So this is all I had to say about uterine polyps. Thank you for hearing me out and hope this has helped. Thank you.